Hey, we're Team Longevity.
I would like for you to take a moment to think about the children in your life. How would you feel if they had to go into surgery? You would want the tools in the operating room to be tailored to reduce adverse outcomes and complications. Right now, for children under 8 years of age, some of our youngest and most vulnerable, there is a need for the right kind of intubation device for the upwards of 600,000 single lung ventilation cases occurring each year. Currently, there is no single device that provides reliable, intuitive, streamlined, or cost-effective single lung ventilation. Current solutions also risk dislodgement and unsecured airways. However, our solution, the DuoVent Pediatric Endobronchial tube, ensures a one-step, secure, and seamless intubation for the child you care most about.
Our device consists of two concentric cuff tubes of the same diameter connected along a rotational track. At the base of the upper tube and at the top of the lower tube, there are openings that are each equal in size and that match the diameter of the tubing. The upper tube can be rotated to place the opening in either the open or closed position, allowing this feature of the device to operate like a window. When the two openings are completely aligned, the airflow delivered from the ventilator is evenly split between the descending portion of the lower tube and the opening in the device's wall. Because the two holes do not overlap at all, the airflow proceeds completely through the lower tube and into either the left or the right bronchus, depending on which lung is being primarily ventilated.
Anesthesiologists are able to seamlessly intubate pediatric patients for selective single lung ventilation without concern of potential damage. Our device, the DuoVent, provides a simple single mechanism to either supply or restrict airflow to the operative lung. These features will reduce time spent securing the airway with an inadequate device in the single lung ventilation procedure. Additionally, the intubation and placement procedure of the DuoVent would not vary from the current practice of direct laryngoscopy. This device adds value to the market through providing a solution for single lung ventilation of pediatric patients, which has ease of use and ensures the safety of the patient.
To verify the manufactured device aligns with its design specifications, airflow through the tube will be analyzed using pressure sensors. The expectation is that flow entering the upper tube will be evenly split between the opening on the side of the device wall and the inferior end of the lower tube. Further testing will be done on pediatric anatomical models provided by our clinical sponsor to bridge the verification and validation processes. The models will show if the DuoVent can perform selective, uniform, single lung ventilation in constrained airways.
Moving forward, we will perform risk analysis to determine the harm and hazardous situations that could result from the device's use. Having already conducted patentability and freedom to operate analyses, we will file a utility patent with the FDA. To ensure the device's clinical adoption, we will collaborate with the Centers for Medicare and Medicaid and private insurers to ensure the device's alignment with established reimbursement codes.
Thank you for watching.